Hi, my name is Kristen Wood. I have been working with a group of other nurses on our unit to create a policy that we feel will be helpful to implement in our unit. It involves moving the shift handoff from the hallways into the patient's room to create a bedside shift report. The purpose of our policy is to improve patient satisfaction and patient outcomes by involving them in the handoff process and doing it in their presence so that they can include any information that they feel is relevant. Okay, so next I'm going to give a little background and significance of shift reports. So normally shift reports are held outside of the patient's room in the hallway or maybe at the desk, just like we normally do them in this unit. However, when they're held outside of the patient's room, the patient doesn't have the opportunity to be involved in the share of information. So they may miss out on some information about their health, or they may not be able to relay information that is new or that the nurse didn't know about. So that just kind of puts it at a little bit of a disadvantage. We also know that as nurses, we are held to a higher standard of patient-centered care. We are required to put the patients first and let their needs and their health dictate our care for them instead of other factors, such as maybe their family members. Moving the shift report to the bedside allows for us to be able to put the patients first. Additionally, just a little bit of significance. Studies have shown that when you move the report to the bedside, things such as medication errors, pressure injuries, and falls are decreased. We all know that mistakes happen, and sometimes things like medication errors will happen, and as much as we can try to avoid them, mistakes are inevitable. But if the patient is involved in their care, they may be able to catch some errors before you do and before that anything bad may happen. Another thing is that patients have shown increased satisfaction. So they have been able to notice that they're able to meet their nurse earlier on in the day and they feel like their nurse is more attentive to them. Just a couple of factors that allow the patient to feel more welcome and feel like they are being cared for to the highest standard.
Hi, my name is Jenna. I will be going over the scope of the policy and procedure. So based on the research that my group and I went over, we found that after implementation of bedside shift reports, patients with hospital stays rated that they had increased levels of satisfaction with their hospital stay. They felt that they had more participation in the making of the care plans, as well as their family had more participation. They also felt that they were a larger part of the decision-making process and felt that they had more autonomy with their care. So based on this research, we felt that bedside shift reports should be implemented in all units of the hospital, but especially in the units with patients that have overnight stays or multiple overnight stays, just because the care plans change frequently and we want continuity of care for all of our patients.
Hi, my name is Crystal Edwards. I'm here to talk to you guys today about our policy statements here at the hospital. So there's two main ones that are really important to us here at Stellar Care. So the first one is communication. So it's really, really important to us that we communicate well with our patients, and not only with our patients, but between each other as the healthcare workers. And the second thing that's really important to us here, one of our key policies is to provide safe and effective care. So these two things are some of our highest priorities here at Stellar Care Medical Center. And so as we thought about ways that we could reach both of these policies here, one thing stood out to us, and that was bedside report. So bedside report not only helps us to communicate well between members of the healthcare team, but it also helps us to communicate well with our patients and keeps our patients up to date. And going along with our second key policy here, to provide safe and effective care, by doing bedside report, the safety of our patients is enhanced as they are part of the communication process and as they give their input into the things that we talk about and the way that we communicate as nurses. And so, as you can see, the bedside report really helps us with these two policies.
Hi, my name is Lauralee, and I'm going to be talking about the procedure for the actual implementation of bedside shift report. So first, the most important thing to do is to create a standardized handoff procedure for your department's needs. This is going to look different because each department has different needs for this handoff. Next, you're going to want to educate all your nurses on the new standardized handoff. And during this process of the education, it helps nurses be able to ask any questions or pose any concerns that they have about the new standardized handoff. While explaining this to the nurses, be sure to talk about the positive outcomes of patient-centered care and nursing communication. With the standardized bedside shift report, patients have said that they feel they have a voice in their own care and that it has decreased nurses' communication errors. So these are both two great things. After nurses have been educated on the new standardized handoff, be sure to audit the handoffs 1 to 2 weeks after the process has begun. Make sure it's randomized, that way nurses don't know when you will be auditing them. This just makes sure that the bedside shift report is actually being implemented correctly. So this is now for nurses who are actually doing the bedside shift report. First, you'll enter, like you usually would, introduce yourself and the new nurse. While you're going through the new standardized shift report, be sure you're facing the patient so they feel included in the conversation. Be sure to meet each step of the new standardized shift report, and before the conversation is ended, answer all patient and nurse questions so that way everyone feels confident in the new patient care.
We believe that through implementing bedside report, we'll be able to implement a more Christ-centered care for our patients and really be able to apply the healer's art into our care. And as we know, the Savior always cared for people one by one, and he was there by their side. And we believe that as we are performing our bedside report and as we're by their side, that we'll be able to become more like the Savior and to help others heal the way that they should. Thank you for listening to our presentation about bedside report, and we're excited for this to be implemented into our care here at the hospital.